Well, this is Bob Browner with Community Coronavirus Update number 111, and basically we'll talk about sort of the backstory about should I get a fourth shot. And the spoiler alert, it kind of depends, unfortunately, so don't expect a black and white answer out of this. But also kind of depends a little bit on what you're trying to prevent, infection versus sickness versus things like that. We'll talk about systemic versus mucosal immunity as a sort of evolving concept. So how we do in the United States, you'll notice the CDC version of risk is showing most of the country is green, which is good. However, it's missing one key variable. A lot of folks I know are a little disappointed they don't use test positivities to make sure we're testing enough to see whether things are going okay. But generally, I think for the most part, our risks are pretty low. There's the COVID Act Now method is a little more sensitive, and it looks like there is a little bit of an uptick, for example, in the Northeast, up in New York, Maine area. So something to kind of keep an eye on, but generally I think we're in pretty low risk in the United States, most areas, including Nebraska. And so yes, there was a headline at the World Herald said cases, hospitalizations down, COVID cases tick up, but just a little bit. So I'm actually not really worried about our Lincoln area at this point. But you also have to be careful. You need to realize one of the problems is a lot of politicians and inexperienced people with public health think incremental, but that's not how pandemics works. They work exponential, and so things will percolate and then take off dramatically. And so you have to watch this carefully for signs of this happening. And it isn't unique to public health. This is actually a business article for Harvard Business Review where the same things can happen. And this is they're talking about the technology center. It's an interesting article to read, and I've got a link to it. But you have to realize things can take off pretty quickly, so we need to monitor this pretty closely. The good news is the current state of affairs, and like your local epidemiologist talks about, is that you have to watch out for sort of two competing trends. The visual she uses is those little red dots essentially is how cases are dropping. The green line with those blue dots, that's the subvariant BA2 is growing in sort of another trend. And so what the overall trend when you average the two out could be that we've got an increase. This is a projection, but may not be accurate. The real answer is this happening in the real world? And the answer, it kind of depends, unfortunately, which is a common answer for both lawyers and epidemiologists. If you look at case rates across the country, you'll see that US and Canada don't seem to be having much of an Omicron rebound, but Italy, United Kingdom, and Ireland had a little bit of one, but not too bad. But Germany had a really big rebound. And so some things varied based on local factors, vaccination rates, things like that. But for right now, the US is still looking pretty good. So I wouldn't be worried about much, and probably wouldn't even be recording this episode except for all the controversy about whether she get a fourth shot or not. And locally, we have other data points we can look at. So in addition to our health department, we still have the UNL testing data and the contact tracing at Lincoln Public Schools, both showing very, very low rates of transmission. So I don't wear a mask when I'm going out to a restaurant right now or anything like that. So but keep in mind, though, COVID is still in the top three causes of death. Partly that's holdover from Omicron, from the deaths that sometimes it takes, unfortunately, 3 to 4 week ICU stay before that death happens and gets recorded. So hopefully we'll see these deaths start dropping off more dramatically. But we've had a lot of deaths from COVID. How people did, a lot of it's a variation of factors, so I keep updating this slide. Lincoln Lancaster County did better than everybody around us, and it's probably a combination of three things. One is timely masking, two is really good medical care and treating with antibody infusions and Paxlovid, but really vaccination is probably one of the biggest ones, and that's why we did so much better than everybody around us. So the real answer, I think the biggest priority isn't necessarily the fourth shot, it's just getting people that third shot. And so here you have the risk difference between not having a vaccine, getting 2 shots, versus the boosted, in this definition is 3 shots. So 0 shots, 2 shots, 3 shots, risk of death. You notice by the time you get your 3 shot, your risk is so slow, so an incremental increase isn't going to be that big, but it still might be worth it for you, which we'll talk about in a little bit. Our problem in the United States is our 3 shot rates are still much lower than everybody else. Interesting, the Japanese, they're always slow to get started, but once they get started, man, do they take off. And so they've done a good job, but because of did so well about keeping rates down with masking, despite that lag in getting people vaccinated, they still have some of the lowest deaths in the world. So if you look at cumulative deaths over time, the Japanese, and most of the Eastern Asia did a really good job, although China is going to mess it up really bad. That's a whole nother story. In the United States, unfortunately, we started well, but we just didn't do a good job getting that booster, that third shot, and that's why we overtook, unfortunately, even Italy and the United Kingdom. So we could have done a lot better, but we didn't, because we've just been so low, lacking on vaccinations. So the CDC did come out April 1st, and they said everybody over 12 should be getting 3 shots, but some people can receive two boosters, which is essentially the fourth shot. And I wish we just dropped the booster terminology all again. You get three shots, or you get four. If you're over than 12, you should get three, no questions about it. Even if you've had a prior breakthrough, prior COVID infection the hard way, everybody should get three, and we'll talk about why in just a minute. But some of us may want to consider four, and I'll talk at the end just about why you may or may not decide to get four. So in Lincoln, the good news is our rates, at least here, we're better than the 30% average for that third shot. We're at 37%. I wish that were higher. So one thing to think about is again, I keep hearing people say, well, the study said the fourth shot wasn't effective, and to which I would say effective against what? Was it effective against any infection or a mild infection, or was it effective against death and hospitalization? That's becoming kind of a key determinant. So higher risk people, that fourth shot is being more protective about death and hospitalization. It does provide an incremental benefit. So if your baseline risk is a little higher, you should consider that fourth shot. An evolving concept now is thinking of our immunity in two different body compartments. One is systemic immunity. That's the immunity that's through your whole body, like your heart and your lungs, that keeps you from being dead or hospitalized or getting long COVID. And the mucosal immunity, that's the lining of your nose. That's what prevents a mild infection or asymptomatic infection. And so what we're seeing is that the vaccinations are very, very, very good against systemic immunity, but not always working against mucosal immunity. So that breakthrough where someone got two runny days of a runny nose or a slight cough, that's not a big deal. We're not too worried about that. And the quote hybrid immunity may be a combination. Let's say you got three shots of Pfizer, but then also got the Omicron breakthrough infection in January. Well, one, you've got really good systemic immunity and probably some mucosal immunity as well, so that would put you more protective. And so getting infection the natural way, unfortunately, tends to be better against mucosal immunity, but not as good about systemic immunity. The vaccine seems to be very, very much more predictable and effective against this, and this is what you're really worried about. You're worried about being dead or being hospitalized or having long COVID. You shouldn't be a lot worried about getting symptoms equivalent to a common cold. So a brief segue, one of the things people keep saying, oh, but 3 or 4 shots is a lot of shots, to which I say, no, it isn't. That's actually typical. And so one of the things I gave a talk to Youth Leadership Lincoln a few weeks ago, and I talked to the kids about, 150 years ago, average life expectancy was only 30, 40, 50 years old. And the reason for that is because half of the population died before they reached adulthood. So if half the people make it to 80 and half make it to 0, the average is 40 basically. The main reason for the lack of life expectancy wasn't because people didn't live to be old, it's because so many people died when they were young. And of course, pandemics have always been a big problem. So this was the influenza epidemic of 17, 18, 19. Look at that huge chunk in life expectancy it took out of us. So if you look through history, and I sometimes encourage people, go to an old small town cemetery and look at the old section, you'll see that a lot of children are in those cemeteries. Now, you've used this numerous times in the past, but it's still illustrative. And this is my great-great-grandparents, Otto and Anna. My great-grandfather, Herman, 3 of his siblings died, one of typhoid, 2 of diphtheria. We don't have typhoid deaths because there's clean water and sanitation. We don't have diphtheria deaths because we vaccinate against people. And so what I asked the Youth Leadership Lincoln kids is, how many diphtheria vaccines have you all had? And they kind of looked at me blank, and they said, well, I don't know, 2, 3, maybe, I don't know. Well, the answer is 6. In Nebraska, we have vaccine requirements to attend school, and you'll see that the diphtheria, tetanus, and acellular pertussis vaccine, you get 3 doses at 2, 4, and 6 months, a 4th dose as a toddler, a 5th dose at kindergarten, and then a different formulation of the vaccine, by the way, at 11 and 12-year-olds. So all those kids in that room have had 6 diphtheria vaccines. So why are we so freaked out about about having to get 3 or 4 COVID shots when many of our infections require at least 3 or 4 shots, like Haemophilus influenza or pneumococcus or polio, for example? Many of these are 3 and 4 shots, and of course flu shots every year. So it's not unusual for a respiratory virus to have more than 2 shots. So don't worry so much about that. And that's because yes, we had we don't have to see interesting to see a slide. We've already seen a pretty big drop. This slight drop. This was the opioid epidemic, by the way. This is the first year of COVID. We'll probably get a second year and hopefully rebound back again after that. So again, getting that third shot's the big one, but you might want to get your fourth. A while back, I used Dr. Poland's concepts about how your immunity may work for COVID. One, that the systemic immunity seems to be better about vaccination versus natural infection. So this is one way to think about it. The other thing to think about is you get some immunity from the first shot, a little more against the second shot, some waning, which we see. That's why you should get their third shot. And the question is, after the third shot, will we see more waning below this, or will it be more persistent? We don't know that. It's going to take time. Basically, we do have some waning after 4 to 6 months. So if it's been 4 to 6 months, you may want to consider getting your fourth shot for a couple different reasons. However, we don't have perfect information, so I love this quote from Colin Powell about the 40-70 rule. This is, of course, in military engagements. You can't wait for 100% of the information because by the time you act, you might be dead already or already losing the battle. And so there's a window of opportunity where you have to make a decision, and we're not in the 100% territory. We're sort of in the gray area now, but so you're going to have to make a judgment call whether to go and get your fourth shot now. So I'll talk about, what would I do? And what would I do? Well, depending on your own risk, you're going to look at a couple things: your own health risk, your own risk tolerance, the health of those around you, because maybe you're protecting a spouse who is immunocompromised. What if you had 3 shots in Omicron in January? We've got pending travel. All these things could push you one way or the other. So if you are immunocompromised or have a high health risk, if you're older than 60 with health problems, I would definitely get that fourth shot. If someone around you has the same issue, or if you just don't want to tolerate any risk, I'd get the fourth shot. The risk of getting the shot appears to be very, very mild. So the side effects for the fourth shot seem to be milder than the first, second, or third. And the people I know who've gotten there so far, including my spouse, have actually not had much of a side effects other than a sore arm for that fourth shot. If you had 3 shots plus the Omicron in January, well, I think you're pretty well covered for now. You might want to wait at least 6 months out before you do it, unless you've got some high health risk, or if you're pending travel. And so what am I going to do? I'm actually going to get my fourth shot tomorrow. And the reason I'm going to do it is because, I don't know if you saw back earlier, we're going to be visiting my daughter in Ireland, and their numbers are a little higher than ours. And so because of that, I'm going to get a shot in tomorrow. I'm actually going to get a Pfizer. I've had 3 Modernas previously, and as you can see, it's been 7 months since my last one. So it's, for me, it's been more than that, 4 to 6 months. And because we're going to go to a country where there's a little more spread happening right now, we do that for a couple reasons. One, just for timing wise, is I want to be healthy the whole time. I want to be fully protected. Also, one thing I have to worry about is what if I turn Omicron positive and I have to quarantine for a week and I miss a week of work because I can't get back from Ireland to back to work. So there may be a productivity reason for why you want to do this. And my wife is a physician, for example, and so having to take time off work means she can't see patients for a few days. So you may have some decisions like that. So ideally, we would time that shot for when the next surge is going to have. You can watch that. So if you're not going to travel, no rush unless you've got some health conditions. Like I say, if in doubt, talk to your doctor about this. That should be your best source, is your primary care doctor. But if you've got travel coming up, then maybe you ought to consider that fourth shot, and that's why I'm doing it. However, just for background, I'm a 52-year-old male with no health problems. So, and if you're over 50, that's certainly an option. But the big thing is get at least 3 shots. So hopefully that discussion is helpful to you. Of course, the links are in the notes section below for all these places I cite. And then, of course, disclaimer, these are my opinions, not necessarily those of the places I work, but that's how you know what I do for a living.